I'd like you to welcome the Prime Minister of Australia, Julia Gillard.
Thank you very much for that welcome. Thank you, John. Can I start by acknowledging that I'm joined today by Mark Butler, who is our new Minister for Mental Health and Ageing. It's great that he could be here. Can I also acknowledge my other federal parliamentary colleagues, Chris Bowen, who is the Minister for Immigration and Citizenship and who has played a role alongside Julie Bishop in the federal parliament promoting Lifeline. Can I also acknowledge our new Parliamentary Secretary, David Bradbury, who's here, Senator Doug Cameron, and can I specifically acknowledge Gladys, who plays a role as a spokesperson on mental health here in New South Wales. It's fantastic that she could join us. I want to say to John Brogden and to the team at Lifeline and Macquarie Bank, thank you for organising this very special event. And before I begin to speak in substance on what I want to say about Lifeline, I do want to make mention of a very special person, and that's Dawn O'Neill, Lifeline's CEO, whose decade of service to this great organisation comes to an end next month. But of course, she's moving on to other things, coming to join us in Melbourne, so that's a great thing. She's great to live in Sydney too. We've been trying to talk her into a football team, but we haven't quite managed it yet. She's going to do a due diligence, I think, before she opts, which is a smart thing to do. Dawn's made an extraordinary contribution, fostering a period of major governance and service reform for Lifeline, and her work was fittingly honoured by an Order of Australia last year. So thank you, Dawn. Friends, just about all of us would have been touched in a personal way by the tragedy that is suicide. A friend, a family member, a colleague, a neighbour. And always we ask ourselves the question, that dreadful question, could I have done more? Could we have done more? Almost 50 years ago, it was those same thoughts that inspired Lifeline. John's told you the story of how this 24-hour crisis support service began. This initiative has done immeasurable good for almost half a century. Lifeline now answers something like 500,000 calls a year, and as John has said, many of them come from people who are at really high risk. So today I honour the 1,000 staff and 11,000 volunteers of Lifeline and all of those who have served with Lifeline in years past. All of you are part of the Lifeline story, and each of you is entitled to feel very, very proud. Lifeline has helped take the issue of mental illness out from the shadows and into the light. The community's understanding of mental illness is probably greater now than it has ever been. Much of the stigma of discussing mental illness that once existed in our nation is now gone. And what remains is being stripped away by advocates like John Brogden himself, Jeff Kennett, Jeff Gallop and Maurice Yemmer, and outstanding leaders in the field like Ian Hickey and Pat McGorry. I want to pay a special tribute to John Brogden today, a man whose own challenges were faced in the harsh glare of public scrutiny and whose courage and dignity are truly an inspiration. Thank you, John. Friends, I too am no stranger to this debate. My father was a psychiatric nurse, and I learned from him that mental illness is no less debilitating than sickness of the body, nor less worthy of our care and concern. I was inspired when I was first in federal parliament by my first visit to Origin and Headspace some years ago, and I'm determined that as a government and as a community, we step up our efforts to address the scourge of mental illness, which too often ends in the devastating contemplation of suicide. Our wider health reforms are the critical foundation for taking mental health forward. We're making investments in enhancing frontline services, such as after-hours support, e-health and GP super clinics. And we're investing in subacute mental health beds to give people more options for care. And through our national network of Medicare locals, we will be able to identify and fill in gaps in access to mental health services because too many Australians fall through those gaps. And by taking full funding responsibility for primary care type outpatient services, we will be able to support more mental health services in community settings. And by becoming the majority funder, we will reduce incentives for cost shifting out of hospitals. I'm also proud to say that we're doubling the number of headspace sites across the country to ensure every capital city has at least one service. And we're supporting the Early Psychosis Prevention and Intervention Centres, or EPIC model, to provide treatment and support for up to 3,500 young people. But friends, more can be done and more should be done. That's why during the election I announced major new plans to redouble our efforts for tackling suicide. I think of those 50 people ringing Lifeline every day and imagine the anguish that leads them to see taking their own lives as the only way out. And I know that in a community as caring as ours, they should not be left to face that darkness alone. Under our package, the government will provide $277 million to boost frontline services, prevention and early intervention. Our new measures will include psychological counselling services for around 12,000 people each year who have attempted or are at risk of suicide, and up to 20,000 specialist psychiatry sessions. We will establish outreach teams for schools affected by suicide to help reduce the risk of copycat behaviour. And we will fund greater online resources for young people, because we all know that very often they value services on the net more than services provided in face-to-face settings. Importantly, from today's perspective, we will help Lifeline expand its hotline capacity by making calls from mobiles toll-free and enabling Lifeline to establish dedicated helplines at suicide hotspots. We will also help improve safety more broadly at suicide hotspots, such as the Gap in Sydney, and I warmly acknowledge Malcolm Turnbull's advocacy on this issue. In fact, I can announce today that the Minister will be speaking to the Wallara Council next week to look at what remaining work needs to be undertaken at the Gap and get funding and work underway. Friends, our package also targets one of the nation's most at-risk groups, men, who account for 3/4 of deaths from suicide, yet only 28% of men seek help for mental health issues. A large part of our package is therefore aimed at helping overcome those woeful statistics by expanding Beyond Blue's national workplace program to help use the workplace to identify and support those with depression who are not receiving assistance, by increasing the capacity of Beyond Blue's helpline to provide information and assistance to up to 30,000 more men per year, and by providing targeted campaigns to help reduce the stigma associated with mental illness and encourage more men to seek help. These are things that we promised in the election campaign, and these are things which we will deliver. And I can assure you personally that issues associated with men's health will be regularly drawn to my attention, because my partner Tim, who is with me today, intends to continue his advocacy work on men's health issues. But if John Brogden and those other mental health leaders have taught us anything, it is that the journey still has a long way to go. We've come far, especially in the past 5 years, but there is still much, much more to do. That's why I said in July that mental health would be a second-term priority for my government if it was re-elected, and I meant it. We've made an important start by appointing the first ever Minister for Mental Health in the Australian Government, Mark Butler, a new minister with a great capacity to make a difference in this field and who has already made an outstanding contribution to health reform as a parliamentary secretary. Mark, Minister Roxon and I are keen to work with frontline service providers and experts to close the gaps in mental health service provision. We know the sector is also calling for a 5 and a 10-year plan, something that fits with the government's commitment to orderly and constructive policy development. We also need to ensure that services meet consumers' needs, because long gone are the days when experts simply impose solutions from above. That's why I have specifically asked Mark Butler to go and speak to consumer and carer representatives around the country to hear their stories and experiences firsthand, and I know he's already out there doing precisely that. Most challenging, perhaps we need to better connect the web of services that those living with mental illness rely on, not just in health, but across housing, education and employment as well. Getting the quality and design of services right will take a great deal of thought and consideration. We can't just treat people's medical needs only for them to end up homeless or without skills and employment, because being without a job, being robbed of the dignity of work, so often sets people on a path towards hopelessness and despair. Designing a network of services to address the whole picture won't be easy and it won't be quick, nor do we simply want to graft ad hoc reforms onto an inadequate system so that another government will have to change it all again in a few years' time. We want to get this right, and we will. As we work towards reform, I take great comfort from the fact that Lifeline and other leading organisations like Beyond Blue will continue to offer a hand of hope to those who need it. The government respects and supports your great work. You are indispensable allies, not only in the struggle to deliver better services, but to combat the stigma that makes mental health issues a greater source of suffering than they need to be. Today, our message to Australians living with mental illness is one of encouragement and inclusion. We say that much more must be done and will be done to ensure that you do not walk this path alone. And we will fight the remaining barriers of stigma and prejudice to ensure that your illness is never the sum of who you are. In Australia, no one should be typecast as mentally ill, because the days of defining people by their condition are over. There are simply people who live with mental illness, loved ones, colleagues and friends who have conditions that are eminently capable of being treated, managed, cured in some cases, but always, always understood. No one knows more about the gift of understanding than Lifeline, because that's what you've been doing for 47 selfless years. I know everyone here today will respond generously to the needs of Lifeline, as it so clearly warrants and deserves, sustaining this great organisation to its 50th birthday and well beyond. It's an honour to share this event with you and to lend my support as Prime Minister to this cause. Confident in the future, let's go forward and achieve some great things together. Thank you very much. Thank you. I will go to